To bring doctors to hospitals serving rural Kansas, including now an offer of a housing incentive, part of an approach the Hutchinson Regional Healthcare System is taking to address staffing needs and care for patients. New at 6, as Sean Logging finds out, the hospital wants to see these providers rooted in the community.
The birthing center at Hutchinson Regional Medical Center is getting ready to welcome a provider who will join them full-time later this month.
This is a community that is underserved for women's health and maternity care services.
The addition of OB/GYN Dr. Doug Moore sees his family resettling in Hutch. That move will be the first to receive funds from a new housing incentives program from the healthcare system.
A new beginning around how we're thinking about recruitment coming into the community. And we're looking at it in an inclusive way. We're looking to build inroads to ensure that the Moore family thrives, because if the Moore family thrives, so will Dr. Moore.
The foundation for Hutch Regional putting $750,000 toward this effort. The healthcare system's president and CEO, Benjamin Anderson, says for a 3-year commitment, doctors get up to $50,000 for housing. The program also extends to advanced practice providers and therapists. This goes beyond just talent attraction for Hutch Regional, as the hospital says there's value in having their providers not just working but living in this community.
We believe that physicians are a crucial part of any community, and it's so important to us that they feel a part of the community. And often housing is a challenge, and we want to remove a barrier for physicians to live here, to integrate.
Anderson says it is one component in a broader effort for staffing, with changes to the maternity and parental leave policy and employee health plan, along with evaluating housing options for other frontline workers. In Hutchinson, Sean Logging, 12 News.
Hutchinson Regional also partnering with the Wichita YMCA for a new facility in Hutch with child care to help support healthcare workers.